Welcome to Grace Hospital. Today we'll be telling you about what you can expect if you're having a gastroscopy. We hope that this video will help you prepare and reduce any concerns that you may have. Gastroscopies are used to identify many conditions, abnormalities or disease. The specialist will view your upper digestive tract on a video screen to look for anything unusual, and they may take a biopsy at the same time. Gastroscopy is a day patient service, which means that you'll be in and out of hospital on the same day. At Grace, they are performed here at our ORAPI Centre, our dedicated day stay unit, which is adjacent to the main hospital. The ORAPI Centre includes a specialist endoscopy facility which meets the highest international standards and has been designed specifically with your comfort in mind. When you're having a gastroscopy, it's important that your stomach is empty. Before the procedure, you'll be given very clear instructions on what preparation is required and when. Please follow these instructions carefully, as this is crucial to achieving the best outcome from your procedure. And if you're unclear about anything, please call our nurse to clarify. On the day of your appointment, please bring a list of any medications that you're taking, including prescription medicines, homeopathic remedies, or any other drugs purchased from a pharmacy. When you arrive, come directly to the ORAPI Centre rather than going to the Grace Hospital entrance. There's plenty of free parking, and we encourage you to bring a friend or family member to support you as you check in and prepare for your procedure. A nurse will talk you through what you can expect during your admission at Grace, discuss your health history, and take observations such as blood pressure and pulse. This is a good time to ask any last-minute questions or discuss any concerns that you may have. We'll also insert an IV through which we will administer any medication that you require. At this stage, your specialist will meet with you and ask you to sign a consent form which gives your agreement to the procedure and discuss sedation options. Gastroscopy can be performed without sedation. Your specialist will discuss this with you also. The back of your throat will be sprayed with a local anaesthetic to make this procedure as comfortable as possible for you. And if you're having sedation, it will be given through your IV. This will make you feel relaxed and sleepy. You'll be asked to lie on your side and put a plastic mouthguard between your teeth to protect the scope during the procedure. Your specialist will gently pass the endoscope, which holds a tiny camera, down your esophagus to the stomach. When the endoscope is in place, gas is passed through to inflate the stomach to make the lining easier to see. This can make you feel bloated or full. Belching or burping can help to relieve this feeling. The specialist views the images on a screen position nearby. These images assist him in making an accurate diagnosis. The process takes place in a darkened room, which improves the clarity of the images. During the procedure, your consultant may pass an instrument through the endoscope and take small pieces of tissue, called biopsies, and these are sent for microscopic examination. Following the procedure, you'll be taken to our recovery area and carefully monitored by our nurses. It will take about half an hour from administration for the throat spray to wear off. Your admission at Grace will take 2 to 3 hours overall. Some patients may not even remember the procedure. We'll give your support person a call when you're ready to have visitors. They can join you as you have something to eat and drink and relax for a while. Your nurse will talk you through any ongoing care and tell you what you should do if you feel unwell or have any complications, although this is very unusual. If you chose to have IV sedation for your procedure, you won't be able to drive until the following day. It's very important that you arrange transport home. We also recommend that an adult stays over for the first night to keep you company and make sure you're comfortable and feeling okay. Your specialist will discuss your procedure with you before you go home. It's a good idea to have someone with you during this discussion, as often the effects of the sedation can cause you to have difficulty remembering the conversation. We perform hundreds of gastroscopies here at Grace, And our focus is on doing everything we can to make sure your experience is relaxed and stress-free as possible. The majority of our patients go through the process with no difficulty at all. But if you have any concerns or questions, please do ask. We'll be very happy to help.